Super excited about today's show. We're going to jump in on what's happening in the policy world of healthcare AI. We have two fantastic guests to sort of really break down everything that's happening in the private industry, some coalitions that are forming, and then what's also happening on the government side, both state and federal and Congress. So I'd love to jump in right away and go to our first guest. Brian, do you want to tell us a little bit about your background and what you're up to today?
Well, great. Well, thanks for having me, Missy. It's a real pleasure to be here. So I'm a physician data scientist by training, practiced clinically for a number of years, trained in primary care, and only got into digital health probably about 5 years and 6 years into my clinical practice. Began working at an EHR company and spent a number of years there building up our clinical services team. And that was really where I first got into AI. And so as part of the role that I had helping to lead the digital health work at a company called MITRE, that's where we launched the Coalition for Health AI about 3 years ago.
We all know MITRE very well, especially those of us that have worked in the government. We're going to come back to the coalition and hear a little bit about that. Let's go to our next guest, Randi. I think a lot of people know you and know of your work, but tell us a little bit about your background and where you're working and kind of your expertise in AI and what you're up to.
Great, thanks, Missy. I'm Randi Seigel. I'm a partner at Manatt Phelps and Phillips in Manatt Health. I'm a healthcare regulatory and transactional lawyer. I've been practicing for close to 17 years. I've always been a regulatory nerd and really like to focus on sort of variances in state law and regulations. And I work with a lot of emerging companies where it's relevant in the privacy space, the telehealth space. And all of these companies also have to navigate sort of the federal overlay of regulation in healthcare. And so it was sort of a natural fit that I started to track and get really interested in how artificial intelligence is getting regulated, in part because a lot of my companies are thinking about using artificial intelligence or innovating in that way. But also it's sort of a similar progression to what we saw happen in the privacy space, where we were sort of waiting for federal activity. And there started to be a lot of state activity, and also similar to sort of how some of the telehealth landscape evolved. So I've been tracking with some of my colleagues all of the state activity in the last year around bills that have been introduced and passed specifically on artificial intelligence as it relates to the healthcare system, and then also tracking what's happening on the federal level.
Yeah, I mean, just a little plug. I think many people know both Manatt Health, which is sort of a consulting firm, but also Manatt, the law firm, right? And I would say that I think, I've looked at a lot of AI trackers and particularly in healthcare, yours is extremely robust. So for our listeners out there that really want to track what's happening state by state at the executive federal level and congressional level, even globally, I think it's super interesting, specifically as it relates to healthcare. So we'll loop back to that. Brian, tell us, what is chai? I've been hearing about it like for years, but now I'm really hearing about it. There's lots of really sort of interesting people that are joining. What is the purpose of it? And is it private industry based? Is it sort of federal and private? Talk to me about it.
Missy, you've never had chai tea before?
I have. That's why it's so easy to remember.
No, in seriousness, so Coalition for Health AI was an effort that we started 3 years ago. It was in the middle of the pandemic when you had a lot of what I would call inherently competitive companies working together to solve a lot of the problems that we were facing in the pandemic. I had the pleasure of working with a number of them as part of an effort with the White House COVID task force. You had Google's and Amazon's and Microsoft's working together. You had Moderna's and Pfizer's and Lilly's working together. And I think it was in that milieu that I think, appreciated the kind of impact that we could have across these competitive organizations when you found a common space where it was pre-competitive. And so it was really in that kind of lens that a number of us started asking, okay, we're working in the pandemic. What more can we do? Can we look at AI? And one of the first questions this small group of us asked was, do we have technically specific consensus on what good, responsible AI looks like across its model's lifecycle? And the answer we quickly came to was, no, we don't. We have, amazing work happening in places like Microsoft and Amazon and Google and different health systems, but there's not much sharing going on around those best practices. And so that was really what started Chai was this mission towards building a consensus set of definitions about what responsible AI looks like. And I think the part of the reason why many of us were so motivated is because with that we can focus on, the second mission of Chai, which is really to help create this network of independent, very competent, trustworthy quality assurance labs to be able to validate if a model is adherent to those best practices, right? And so if we want to build AI that is going to serve all of us, we need to be able to have a way to validate that the AI is being built in such a way that it is representative of all of us. And so that has been the mission and charter for Chai since we launched, is building that consensus and then building the evaluation framework that allows quality assurance labs to be able to partner with the developers of models and the customers of models to be able to understand if these models are safe and effective. And so we're really excited about that. The organization, I think, is now 3,000 members strong. I think it's the largest health AI coalition on the planet. And we're really excited about the opportunity to bring the private sector innovators working alongside the public sector regulators. That's part of the magic in Chai is when you bring those two stakeholder groups working together in the working groups that we've launched.
Yeah, I'm super excited. I know a lot of people that have joined, and someone who used to work at Google, Amazon, Box. I think
that's right.
I know my former companies are there, and lots of friends from other big companies. Randi, maybe we could just have you break down. I think I've heard you speak a couple times, and what I really like is you sort of start a lot of your talks with, here are the good things about AI. Like, this is what AI can really leap forward. And then here are some things from a policy perspective that we need to kind of keep our eye on. And I wonder if you could just kind of enumerate that for some of our listeners so that they can anchor into this conversation and we can go deeper with what Brian's groups are doing.
Sure. And I agree. I think it's always helpful. I think everyone is very aware of the risks of artificial intelligence. They are out there in the media. And I think everyone, including myself, is a little bit always apprehensive of new technology. So I do think it's important to ground ourselves in understanding how there is promise in the use of artificial intelligence, in particular as it relates to healthcare. So some of the things that artificial intelligence is good at, and this actually was taken from a report put out by the American Medical Association, is around identification. So, taking a look at an X-ray and being able to identify potentially something in an X-ray that the human eye may not be able to identify. There was a new study actually out of JAMA. I think it came out last week that I was really excited about because I also am all about advancing access in women's healthcare. And there was a study that came out that involved about 400 patients, and it shows that novice clinicians using a low-cost ultrasonography probe with AI imaging capabilities was able to accurately determine gestational age. And that this sort of shows great promise in rural communities or areas where there might be a lack of access to prenatal care. And I thought this was just really a great example of some of the promise of artificial intelligence as it relates to identification and image analysis to really not only be accurate, but to provide access to care where access may not exist. Some of the other things that artificial intelligence is good at is translating data inputs. So taking one type of data or data format and translating it. So for instance, there's an example where a radiologist might review an MRI for a patient who might be at risk for breast cancer and dictates observations in an audio recording. The AI tool might be able to convert that dictation into a structured note summary and apply, classic cancer classification schemes automatically. They also might then be able to take that note and translate it into something that is more easily digestible for a patient who gets a summary of not only, the note that the physician dictated, but instead of having to go to Google and sort of figure out what all these things mean, there might be a summary report. Obviously, all of these things need to be validated by the physician and make sure that they're accurate reflection, but it can take some of the workload off.
Brian, did you want to jump in?
No, I was just going to say, I mean, Randy, that last example is just so we talk obviously to a lot of health systems in Chai, and one of the things that so many of them bring up is that example that you're describing of the physicians using the ambient listening tools. And I'm hearing stories of physicians going up to their leadership in tears, wanting to hug them because they're no longer, working, 3 hours at home. They're able, I think literally I heard a story of one physician, their child was asking, how come, daddy's at dinner so often now? And the dad was drove to tears, and it was in part because of these kinds of AI tools that they're able to use now.
That's a really wonderful story. And I have seen some, I'm sure you have too, some of the ambient listening technology is, it's incredible what it's able to do.
Just to back up, I think just to summarize, I think we've heard identification, translation. There's a couple other things. I know lots of people in healthcare are using it for some summaries and summarization. I know some folks back in this sort of traditional machine learning days were, that weren't generative, were using it for prediction. We're seeing that. I think there's a tremendous amount that we could do here with AI. I think what we want to jump to, just because we have so much to cover in the call, is sort of some of the issues, because I think that's where you and Brian are both focused. So why don't you, unless you have anything more to say about the sort of good stuff really quickly, I'd love to get into some of the areas that the regulators and private industry are trying to rally around.
No, I think you summarized it. I mean, I think prediction is some good stuff, but I think that prediction, as Brian will probably agree, not to put words in his mouth, is one of the areas of also a lot of concern, because that predictions may have built-in bias, discrimination, inaccuracies. And I'll let Brian continue the list. But I think prediction is actually a really good example, I think, of where there's a lot of good to come, but also potentially a lot of risk that the different policy frameworks and Chai is looking to sort of help mitigate and address.
Absolutely right, Randy. I mean, one of the things, Missy, that I remind listeners oftentimes in situations like this is all algorithms are, all these AI tools are, be it generative or predictive, is programs that are trained on our histories. And I think as Randy's describing, if the data and the representative sample that these models are trained on is not, inclusive, if the kinds of data sets are representative of, different kinds of biases that may be, uh, uh, overtly in place or not as obvious, it can become a real danger, particularly in subtle ways in the generative AI space to pick up on that bias. And that can be a real concern as we think about the kinds of capabilities that these tools are going to be developing in the not so distant future.
Yeah, I mean, I keep hearing you check me sort of on the sort of top of the top of the food chain on sort of concerns. So clearly bias in the data, the source data, the ground truth data, having a biased data set, which causes discrimination. I think there are lots of people that sort of use these fancy words like hallucination or confabulation. This is when sort of you just get a wrong answer. Or something that is close but not. I call it the WebMD answer or the Grey's Anatomy answer, when you put something in and it's sort of like not quite right. I think there's a lot of people that are concerned about transparency. I hear that a lot, and I'd love for one of you to kind of define what we mean by transparency when we're talking about these large language models or small language models or anything in generative AI. And then the last thing that I'm hearing a lot of hoopla on is this kind of the concern of privacy and security. Specifically, how is PII and PHII being used, or PHI being used in the training? And is it always de-identified, or how do you take traditional HIPAA and move it into this generative world where we've got these large language models and we've got lots of data that's being added to it to refine it? So those are some of the things that I'm hearing about. Maybe you guys could spend a little bit of time on privacy and security and transparency, because I think those are huge things to unwind.
Well, I'm happy to go first here. So I think, one of the first challenges in the generative AI space, Missy, that you're describing is coming up with a common set of definitions, right? What does transparency mean? Because it can mean a lot of different things. And, candidly, at a technical level, at a specific level, people have wildly different definitions about what transparency means or what the thresholds for transparency are. Let me give an example. One definition of transparency is being open and clear in terms of how the model was trained. What was the training methodology for the model? What were the data sets that were used to train that AI model? Your definition of what is adequate in a response to that could be very different from a technology company that wants to protect its IP and how it developed that model. And so that's a real balancing act that we're challenged with, head on. And Chai, is how do we have that common definition of what transparency specifically means in a use case like disclosing what the data inputs were for a model, which is a really important thing, in a way that makes a health system comfortable to purchase it and a technology company comfortable that they're not revealing IP. That's just one example of transparency. There are other principles in responsible AI that we don't even have common definitions of. How do you measure bias? What does that even mean in generative AI? These are real challenges that in the generative AI space, we urgently need to come up with those common set of definitions, I think, that you're pointing to.
What about privacy and security, Randy, and anything else on transparency?
Yeah, I mean, the other thing I would just say about transparency is, and I think we'll touch on this when we get to the state sort of discussion, but what states are defining as transparency also varies. So, Brian's definition of transparency is, makes a lot of sense from a data perspective and transparency around the model. States are also using this word to mean like transparency with not only your customer, but the ultimate end user, or disclosing this information to the state. And so even when they're creating transparency bills, what we mean by transparency and to whom, and then what do we expect the user to be able to do with that transparency is sort of very state by state. And so I think everyone is focused on transparency, as you noted, at the state level, the federal level. But what that means and how effective it is in actually ensuring transparency is a little bit of an open question. With regard to privacy and security, I mean, in some ways, it's pretty simple in the sense that HIPAA, even though it's a bit of an archaic rule, provides sort of a framework for using patient health information as it relates to artificial intelligence. So if you're disclosing as a health system to a third party, whether they are a vendor and the data is disclosed for a static purpose or for use of generative AI, you need to have a business associate agreement with that vendor. And under that terms of the business associate agreement and the services agreement, you as a hospital in this example can agree that the generative AI tool can use your de-identified data to potentially make improvements to the algorithm, or you may say that they can't. You may say that they can use your identifiable data to improve the algorithm solely as it relates to the services they're providing to you, or you can say they can't use it at all. So it doesn't, the fact that generative AI is being used doesn't really change a covered entity, a provider's obligations here.
That's helpful. That's super, super helpful. And I know, just being a California resident, I remember there was something in the news about physician groups back on transparency would have to, if they were using any kind of generative AI, they would have to essentially have a patient communication informing them that they were using a bot or they were using something. So, I've certainly seen some of these laws. We're going to break down federal, state, and so forth. Brian, talk to me a little bit about how you're organizing the industry. Like, are you doing work groups and sort of what are the deliverables? Is it sort of a framework for safety and ethical AI? Is it an insurance, assurances kind of best practice book? Like, what is your organization going to put out to unify the industry?
Yeah.
And how are you getting there? What's the roadmap?
So a lot to unpack in that. So let me start by, kind of just putting out the building blocks of how we're thinking about it. So the first step is bringing together a representative group of stakeholders from across, industry, big tech, small tech, mid cap, health systems, both academic, rural, inner city, um, patient-centered community advocates, and making sure that they're part of it, device manufacturers, payers, all sorts of stakeholders coming into these working groups and coming up with a initial high level common set of ways that we define those principles in responsible AI, be it for generative AI and then for traditional or predictive AI. So we have two big working groups that are coming up with that foundation of what is the definition of good. And then once we have that definition, then you can come up with a set of metrics that allow you to measure if a model is actually in alignment with that definition or if it's misaligned. And how do we measure performance, by the way, in generative AI? All of these things are really use case specific. And so the metrics working groups very much are focused on specific use cases. So once you have a definition and you have the ways that you can evaluate that model, then you can really create a network of these quality assurance labs. So that's the third thing that we're doing is we have a working group helping to create what Chai is launching, which is a certification framework. So Chai will be looking to certify these quality assurance labs that will be using the metrics and using the definitions that essentially the community is coming up with. And so the operational process starts with representative working groups, building the definitions of what good looks like that is use case dependent, developing the metrics, enabling the assurance labs, and then in a transparent way, what we're looking to do is the results coming out of the assurance labs will be shared publicly with the nation. So we're pretty excited about that additional level of transparency.
I was involved with the first inaugural office of the National Coordinator for Health IT under the George W. Bush's second term with Dr. David Brailer. So
yeah,
we were very early on talking about meaningful use, and we had all kinds of attestation organizations. So there's been some really interesting things that the government's put out around certifying bodies, and I think it's interesting that you're replicating that. I want to go back to the labs in a second. So that seems like a really great private industry approach to try to unify private industry. Randi, maybe you could touch on sort of what the government is sort of thinking about. There's a lot of activity on the private industry side. We saw the executive order from Biden. We've seen things from Congress. Just maybe give us a flavor of what's happening on the federal side. And then we'll kind of come back to you on states because there's a lot of things going on in the states.
Yeah, so I mean, I would say there's a lot and there's nothing happening on the federal side, if that's a way to summarize it. There's a flurry of discussion at the federal side coming out of the executive order and a lot of activity around, effectuating the executive order to come up with task force and think about things and frameworks. But it's only been like 270 days. I haven't done the full math since the executive order came out and had a
When was that? It was like, was it in October of last? Yeah. And what was the gist of it? Was it more just sort of a little bit of a kind of paper posting and it wasn't a lot? Or what was sort of the ethos of the executive order out of the Biden administration? And it was generally all AI. It wasn't specific to health.
Right. And I'd love Brian's feedback here because I think I heard him comment on it on another podcast. But, I think it like jump-started some activity. It was 110 very dense pages of wide-ranging, AI-related challenges and proposed coordinated solutions to have a federal government-wide approach. It was not specific to healthcare, although there were some specific actions proposed or directed to be taken by the Department of Health and Human Services, but it was really broadly about promoting safety, privacy, equity, innovation, and international cooperation around use of artificial intelligence, specifically by the government itself, but also, by others who are, big players like healthcare providers. And so, there's been a flurry of guidance and activity to meet these timelines, but I don't know that there's been necessarily, comprehensive real action. And there's no enforcement mechanism really within this executive order. So, it will be interesting to see if there is an administrative change or how much of this activity may continue after the election. But Brian, I'd love your thoughts on if you think the executive order has done maybe more than I've summarized it to have done.
I mean, no, I think you're right, Randy. The only other thing I would add I think a high level is that it really tried to align with the Bill of Rights, the proposed AI Bill of Rights that the White House also put out, I think, a year earlier. I think, the executive order understands that there is an urgent need to develop new ways of thinking about regulating AI, given I think to your point, Randy, it's not just in health that all these use cases are coming up in different kinds of emergent capabilities, and to get our hands around it. And so I think the executive order lays the groundwork for the executive branch to start thinking about what some of those new regulatory muscles that need to be, developed and trained might begin to look like. So, as an example, it's exciting to see CMS begin talking about AI, right? And, they really haven't had a regulatory role in that space yet. And yet they're part of this HHS task force that is stood up by the executive order. And so it's exciting to see things like that.
And Randy and Brian, didn't CMS, CMS did rule on payers being able to use AI for medical necessity, prior auth, and sort of had some guidance around that. That was pretty recent, right? That was
right. That
was very prescriptive.
Yeah, for Medicare Advantage plans specifically, they issued regulatory guidance around the permissibility of plans using clinical algorithms for medical necessity determinations. And then they sort of doubled down on that guidance in a frequently asked questions in February of 2024. But again, and I think CMS is actually going to have a big role to play here because they can easily impose requirements on health systems, hospitals specifically, but different healthcare stakeholders through conditions of participation and their guidance. I think that they might be starting potentially able to, potentially implement that you have a transparency framework or a risk management framework through their conditions of participation. But with regard to the guidance they've already issued, it was it's narrow in the sense that it only applies to Medicare Advantage plans at this point.
Right. But it was big. I think the industry.
It was big, and we're seeing some copycat federal activity. Some copycat sort of state activity, where they're also sort of focusing on ensuring that health plans are not using algorithms to categorically deny medical necessity. And there's also some litigation happening around there. So I think this is going to be a hot area to watch for sure.
Yeah. And, and whether or not there's always a human in the loop, and essentially the AI is doing a lot of the data searching, summarization, data identification, and then, the humans, it renders a decision and the human signs off. And there's sort of refining and human learning at the same time. So anyways, more to come there. I also think there's always been some activity, particularly historically with the FDA, as I recall, because there have been some interesting medical devices that have been using AI for a while. So they've had a little bit of a voice at the table. Are you seeing anything kind of topical coming out of the FDA?
Yeah, the FDA has definitely been the agency the most vocal about regulating artificial intelligence ahead of other agencies, and really trying to work together with other federal agencies to harmonize an approach and to balance sort of the need for transparency and to regulate artificial intelligence while realizing that they don't want to stifle innovation in drug development and devices. So they've issued a lot of non-binding guidance so far related to use of artificial intelligence in sort of software as a medical device and in clinical trial development, but they have not issued anything binding. But they've actually been, my perspective is that they're being very thoughtful in their approach to how they want to regulate AI, and are looking for stakeholder input and hoping to coordinate so that you don't have one one stakeholder sort of having to comply with a bunch of different conflicting, policy requirements.
Yeah, I mean, I think like the big talk, and Brian, I'd love your perspective on this since you have so many work groups. But like, look, there was like, I don't know if there was actually a kill switch bill proposed in California around sort of, I call it the Skynet effect. If you're going back to Terminator days, like, oh gosh, Skynet's going to take over. We have to have like a switch that just like shuts all the machines down. But I think that's something, for those of us that are working in generative AI in the industry and really feel like we're in this sort of technological leap forward. We've had these sort of really interesting technology leaps, certainly with the kind of mobile phone moment in time, certainly sort of voice activation, NLP is sort of an interesting wave. And now we've got all of these sort of like consumer and lay applications and enterprise applications now for generative AI. It's a huge, huge moment in time. And I think there's naysayers and there's also people that are riding that innovation curve. And so, some of the states are really regulating in ways that are sort of trying to protect the provider, the payer, the consumer, and trying to have transparency. Some of the states are being a little bit more conservative. What's your both of your take? Like, the private industry is very concerned about a kill switch. Are we seeing kill switches anywhere? Are people freaking out? Like, we got to shut this down at one point if it goes too far?
I offer, my perspective on this, particularly with the Senate Bill 1047, I think, which is the bill in California that passed recently by the Assembly, I think 32-1. Now it's in front of the Senate, and then, we'll see what Governor Newsom does after that potentially. I think that bill has a lot of really good parts to it. The part that calls for Cal Compute, right? A central kind of space with the compute and access to data to be able to help train and validate and test models and support startups. I think that's a great thing. Helping to tease out, where responsibility and, legal liability lies with regards to these models, I think is a really challenging thing. It was concerning to me when I saw that the open source model developers were being held liable for derivative use of those open source models. I think the amended bill might have struck a better balance around that. But, I agree with the overall principle that this is an incredibly powerful tool. Missy, you're describing all the amazing, capabilities and use cases we're seeing in the generative AI space. And, I'm right there with you. I agree. This is, I think, a really transformational moment. I think it's appropriate for our state governments to begin thinking about seriously, how do we make sure that humans are always in the loop, that we're aligning AI with our human values and principles at the center of that. And it's not, developed in such a way that is, discriminatory against, vulnerable populations. I think it's right for state governments to put into, potential regulatory frameworks an additional level of scrutiny to validate that these models are safe and effective, because they're going to be used in incredibly consequential ways. And developing those frameworks is something that, personally, I regard as appropriate.
It's going to be so hard though if we have all different, like, because this is software and it's generally applied online. It's going to be very difficult if California and Colorado have two different rules. And I don't know, Randy, how you're coaching, clients on that, or if you agree with kind of Brian's take on the bill that's now headed to the California State Senate, I believe.
Yeah, so I think there's like 5 bills headed to the governor to sign that were all related to artificial intelligence. There is this kill bill, which I think these are really for large language models, and I think while have a major potential impact, might have a more limited impact on healthcare stakeholders specifically, depending on the model. There are some like use case bills that are heading to California that are specific to healthcare. And then also, I think like just a data set transparency law. And then, as you noted, Colorado passed a bill that's not effective, I think, till 2026. That has its own sort of multi-layered transparency risk mitigation provisions. And then other states did not pass, but we anticipate lots of other bills to be introduced. I think it's super complicated for a healthcare provider or a technologist who works across states to comply with these different types of bills that mean different things. I also worry that in the end, over-regulation could favor sort of the big players and not the little players that can't hire a lawyer to look at each state and make sure they comply with each of these different provisions. And so I think it does create a risk that it could stifle innovation, or even hospitals' own development and deployment or providers' development of their own artificial intelligence tools. So I think I'm hopeful that there will be some sort of federal framework or at least a carve out, for instance, if you comply with the NIST standards or you are certified through one of these quality assurance programs or something else that you by default comply with the law of the particular state, because otherwise I think it's going to be really impossible for a multi-state provider, vendor, health plan to comply with all of these provisions. I also think we need to figure out like what actually matters. Like there's a lot of like patient disclosure laws around use of artificial intelligence. We've been using artificial intelligence in healthcare for a really long time, and we don't give the patients a right to like opt out of a clinical algorithm around like medication flags because we're using artificial intelligence. So I think exactly. And so I think we have to be like really thoughtful and understand these use cases as to like when does a patient need to be have a disclosure and when can they have a right to opt out? When is it up to the clinician? When is the document that the deployer is providing to a hospital around transparency and risk management so complex that no one's going to understand it and be able to digest it, that it becomes unhelpful? So I think also as we think about regulations, we need to zoom out and make sure that you have so many stakeholders in the healthcare industry participating in those conversations so that we have smart, thoughtful regulation, and we're not regulating a healthcare provider's deployer of artificial intelligence to diagnose something the same way as something that could cause all of our nuclear secrets to be disclosed to another country. They're not, the risks are different and the use cases are different.
So I completely agree. Let me just, put one flag in the sand in terms of why I think it's important to think about how we regulate AI, at least health AI tools, in a regional or geographic way. You know, I'm sure, Missy, you've had others on this podcast, remind our listeners that so much of how one's health is determined are by social factors, oftentimes outside of health, right? Where you live, your zip code, your educational level, how close you live to a grocery store where you can get fresh fruit and vegetables. All these things that are part of our social determinants of health are regionally and geographically unique, right? Someone from Appalachia is going to live a very different life than someone from the Pacific Northwest in some very tangible ways. And when we think about what that means for AI, right? If I am developing an AI tool, and that AI tool is an expert classifier, used for risk prediction for breast cancer, and I train that on a bunch of people in the Pacific Northwest, and it is fantastic at identifying, breast cancer in high-risk individuals. But then I deploy that in rural Tennessee, I run a real risk that that model, although validated and tested and trained in the Pacific Northwest, is going to be worse than a coin flip if I deploy it in Tennessee. And so what we're hearing from a lot of these states is, we just want to make sure that these AI tools are not going to hurt people in our state. And so, we need to think about, balancing that equity and that, I think, legitimate concern with, no one wants to stifle innovation. And so how do we hold those two things in tension is going to, I think, be a really important way that we chart ourselves forward. I think no one wants a repeat of, the privacy laws and that patchwork of challenges that, in the public health emergency, I would say many people, died because we weren't able to get that real-time insight into how how this disease was progressing, because a lot of the challenges around privacy laws, appropriate laws, but challenging to navigate in the health data space.
It's an excellent point. It's an excellent point that goes back to source data and training data, which I mean, I see a world at some point where we're so sort of progressive in our use with these small language models and or large language models. Generally, I think in healthcare, we're going to see the more pervasive use of narrow small language models, particularly that have that are attached to a task or a specific narrow use case, and is refining on clinical vocabulary that's very discrete. And it is so relevant to think about how that data was trained and where that source data came from, particularly when you get to a place where we might even have marketplaces of small language models that other people want to use, or digital agents or co-pilots that have GUI elements that sit on top of those small language models, right? It's sort of like, you're now getting into, I can imagine a Cleveland Clinic or a Mayo or a large ACM that has sort of got scores and scores of data in their region, right? And they're doing a ton of really fascinating research, wanting to actually publicize some of that data and have others benefit from it. And then you're sort of where does that, how does that data actually become liquid and move to a different area? And is it appropriate? So it's a very good point. And I think that does sort of keep us thinking about sort of state regulation. I know we're sort of up to our closing moments here. I think what I would love, Brian, for you to do is to just sort of talk about, in a perfect world, and then I'll ask Randy a sort of a large policy question. But in a perfect world, what does 3 or 4 years ago from now, what does the labs look like? Do you have like 50 labs across the United States? They're, either for-profit or nonprofit, and they're certifying models. Like, what do we look like in 5 years if the groundwork that you're laying now is truly going to get us to another level?
It's a great question. I guess let me start at a high level. One of the things that is really challenging in the generative AI space with these very large frontier models is how we think about evaluating them, because the use cases are, seemingly endless, right? These models are incredibly capable. They can be your personal assistant. You think in 5 years from now, they'll certainly be our personal assistant. I may need 2 or 3. And they'll be influencing so many different, things, from ordering an Uber to helping us, create our grocery list when we go to the store. And so when we think about these assurance labs and evaluating them, one of the things that I think we've been thinking a lot about recently is this concept of human flourishing. And if ideally we want AI to serve all of us, to serve what I would call, an end goal, however you define it, Missy, and Randy, however you define it, what human flourishing means to you, your values, your principles, we need to have an evaluation framework, particularly for health, be it physical health, mental health, emotional, spiritual health, to have a rubric that these labs can use to evaluate these models, to make sure that they, in fact, are aligned with our own individual definitions of human flourishing. And so, Missy, back to your question, I'd see 5 years from now, yeah, I don't know the exact number. We're going to need a geographically diverse, I know that, set of assurance labs to be able to do that kind of alignment that I talked about earlier. But labs that are really taking a holistic approach to how we think about health and evaluating models that are, impacting our everyday lives, be it in the doctor's office or when we're navigating, whatever the future version of Google or WebMD is going to be to help us get answers. I see labs helping to play a role meaningfully in making sure that those models are representative of all of us and serve all of us.
That's fantastic. I look forward to that 5 years from now. I loved it. Yeah. Optimizing my humanity, right? Like essentially trying to figure out what that means for me. And I love it. I've had other guests on the show that have said it's all about augmentation and supercharging, like my role as a physician, or my role, my role as an administrator or what have you. So Randy, not to get topical here on you, you certainly don't have to get partisan, but like many of us, like what are we, like T minus 60 something, 70 something days to the election. A lot of activity right now going on in our industry. What is your best guess, just looking at the policy tea leaves of what you're tracking in the AI tracker and for all your clients? What do you think is going to happen under a Trump administration with AI regulation versus a Harris-Walz administration? Or is there really even going to be a difference?
I don't think AI in and of itself is super partisan. I think that both parties want to ensure that we don't fall behind in AI innovation and want responsible use. Perhaps a Waltz Harris administration, which I said backwards, a Harris Waltz administration might be more prone to regulating and allowing there to be some, liberties taken by the federal agencies. Whereas I could see another Trump administration sort of not. My hope is that if I had a crystal ball and I had like a wish list, is that Congress would act to preempt this space, in particular around transparency, because I want to make clear that I am a pro-transparency lawyer. My concern is just that transparency is going to be defined differently, that they sort of preempt the transparency space that sets forth minimal expectations around what needs to be transparent by the developer to the deployer, because I don't see how we can ever mitigate bias, decide how to use an algorithm, even if it does have bias, but have it's still allowed to have its benefits, mitigate risks, empower the user, empower the clinician, do any of those things if we don't have transparency. And it would be great if the federal government could at least step in there and allow states to sort of layer on protections, but at least your innovators all have an equal playing field in terms of what's expected to them as the bare minimum. So that would be my wish list, and maybe also in light of Chevron, which being overturned, where federal agencies might have less authority unless given express deference, maybe that'll be the impetus for Congress to actually be able to take action in a bipartisan way.
And I believe Chevron was that a Supreme Court ruling, correct? So that was at the federal.
That overturned Chevron, yes. So that was a Supreme Court ruling that took away a little bit of interpretive deference from the agencies in a 2-second summary for another hour-long webinar.
Yes, because that was beyond healthcare and certainly affects some of the agencies. Well, I know we're at our time. I mean, this has been a fantastic survey of kind of what's happening on the private industry side, what's happening on the policy, government, state, federal side. We didn't get a chance to talk about European and global. There are some things going on there. I advise our listeners to go check out the Manatt Phelps and Phillips AI tracker. I think it might be behind a firewall of some sort or a paywall. But Randi, where can listeners get information if they want to map and they want to really start tracking? People can go to the CHAI site for sure too.
Sure. So we have in front of the paywall, very detailed summary with some lift ups of key areas that are emerging across states, and then a federal update. Behind the paywall is a very detailed Excel spreadsheet that tracks every single bill and sort of categorizes its applications. But I think for your general listeners, in front of the paywall is a pretty good and robust summary of where we are, and we're refreshing it on a quarterly basis, and then more frequently if California, if the governor signs.
Yes, if the governor does that
next month, yes.
And Brian, if I'm a tiny startup that just got funding and I really want to get involved with CHAI, or I'm like, Apple, how do I get involved? Where do I go? How do I jump in right away? And I'm sure there's criteria, but just end with that so that our listeners know where to go.
Yes, joining CHAI is really straightforward. There's a join us button online. You can click and join the mailing list and be part of the family and the community. In one easy step. Becoming a member of the working groups obviously requires joining and then signing up for any of the working groups that we have launched at that time. There's a whole form to fill out online, but it all starts with joining and then kind of indicating your preferences in terms of the working groups and getting started and rolling up your sleeves and really digging in.
I advise anyone who is serious about doing things in healthcare using generative AI tools to start with Chai. It's been a fantastic starting ground for many of the companies that I'm advising and or invested in. So big commercial for that. I'm just delighted to finally meet you. I feel like I've been stalking you by reputation. And Randi, you're so well known. Everybody loves what you do. You speak everywhere. It's so great to have you both here. Thank you so much for coming. And we hope to tune in next time. We're going to be talking live from the health conference in Las Vegas, October 20th to the 23rd. We will be interviewing people live in the AI Pavilion. Please tune in for that episode, and we'll be seeing a lot more of you after health. Thanks, everybody.